A prospective randomized trial of thrombin versus cyanoacrylate injection in the control of acute gastric variceal hemorrhage. Introduction. Acute gastric variceal hemorrhage, AGVH, is a catastrophic complication of portal hypertension. The prevalence of gastric varices in patients with portal hypertension is reported to be about 25%, and the incidence of AGVH is half that of esophageal varices. AGVH usually results in more severe hemorrhage and higher mortality than esophageal variceal bleeding. Initial therapies for AGVH, including resuscitation, vasoconstrictors, and prophylactic antibiotics, are similar to those for esophageal variceal bleeding. Endoscopic therapy plays a pivotal role in the cessation of gastroesophageal variceal hemorrhage. Endoscopic cyanoacrylate glue injection has been widely recommended for the therapy of AGVH. The rate of hemostasis with glue injection ranges from 87% to 100%. However, glue injection may be associated with complications such as ulcer bleeding and systemic thromboembolism with fatality. Alternatively, thrombin injection has also appeared to be highly efficacious for hemostasis of AGVH. The advantage of thrombin injection is safety, without inducing ulcers or embolism. Controlled studies between glue injection and thrombin injection have not yet been reported. Thus, Lowe et al. Conducted a trial aimed to compare the relative safety and efficacy between endoscopic thrombin and glue injection in the cessation of AGVH. Background. AGVH is a serious complication of portal hypertension. Endoscopic cyanoacrylate glue injection is standard therapy for acute hemostasis. However, it may be associated with serious complications. The role of thrombin injection has not been confirmed. This study compared endoscopic thrombin and glue injections in the hemostasis of AGVH. Methods. 68 eligible patients with AGVH were randomized to receive thrombin injection, 33 patients, or glue injection, 35 patients. The primary endpoint was injection-induced gastric ulcers. Secondary endpoints were acute hemostasis, rebleeding, and mortality within 42 days. Results. Both groups had comparable baseline data. Hemostasis of active bleeding at endoscopy was 90.0%, 9 of 10, in the thrombin group and 90.9%, 10 of 11, in the glue group, p equals 0.58, and 48-hour hemostasis was achieved in 93.9%, 31 of 33, and 97.1%, 34 of 35, respectively, p equals 0.60. Treatment failure at 5 days occurred in 2 patients, 6.1% in the thrombin group, and 2 patients, 5.7% in the glue group, p greater than 0.99. Gastric ulcers occurred in none of the thrombin group and 11 of 30, 36.7%, of the glue group, p less than 0.001, 95% confidence interval, CI, 8% to 27%. Complications occurred in 4, 12.1%, and 18, 51.4%, patients in the thrombin and glue groups, respectively. P less than 0.001, 95% CI, 22% to 45%. 2 patients who received glue had post-treatment gastric ulcer bleeding. 1 patient in each group died. Conclusion. Endoscopic thrombin injection was similar to glue injection in achieving successful hemostasis of AGVH. However, a higher incidence of complications may be associated with glue injection.